Welcome to My Business Matters, the Michigan Chamber podcast.
Welcome to My Business Matters, the podcast where we talk to the business leaders, the policymakers influencing Michigan's future. I'm Jim Holcomb, President and CEO of the Michigan Chamber of Commerce. Today's conversation is part of our Leadership Lens series, focused on how organizations navigate complex, high-stakes challenges in transformational and turbulent times. We're joined today by Tricia Keith. She is the President and CEO of Blue Cross Blue Shield of Michigan. From her roots on a Michigan dairy farm to leading one of the state's most influential health insurers, Tricia brings a unique perspective on what it takes to operate through cost pressures, system complexity, and constant change in healthcare. Tricia, welcome.
Well, it's great to be here. Thanks so much for having me. I'm really looking forward to this.
Oh, great. These conversations are wonderful, and we're so excited to have you on. But let's give listeners a little background. You grew up on a Michigan dairy farm. How did that experience shape you and where you've come to today?
Yeah, thanks. I like to say that I'm farm raised and city rooted. I am a lifelong Michiganian and really treasure that. I grew up on a 130-year centennial dairy farm in Northwest Michigan, and I had a lot of experiences there that have carried on through my life. I would tell you that my first job was taking care of the calf barn, and you might wonder, what is taking care of the calf barn?
It sounds like hard work.
Exactly, and it was, but it really shaped me. And what it taught me is one of my core guiding beliefs is that the world is run by those who show up, and how that was formed is it was my job to take care of the calf barn. These were baby calves, teaching them to drink, till they were about a year old, and if I didn't show up, they didn't eat. Oh. And that really teaches you how to, be counted on, how to learn responsibility and do that. And that has carried me through all these years. And so I think there's a lot of different definition of showing up now. And obviously the physical part of it but it's also being present. It's having the courage to have the tough conversations. It's how you show up with ideas and creativity. And so, I've probably expanded the definition of the world is run by those who show up, but it's one of my favorite quotes, and it's really guided me.
Yeah, no, I think it's good to expand. I think that makes you a great leader is you're putting your own mark on things. You're taking what you think are traits and characteristics and expanding them. So I'm assuming that job started early in the morning?
Early in the morning before school. It was after school, after sports and other things. Oh. And it being a farmer, it never stops. It's 7 days a week.
Yeah, and like you said, people rely on you to be there. So you're in there, you're taking care of the calf barn, you're by yourself. What's going through your mind? What did a younger Tricia think? Oh, here's what my future is going to look like. I really like this. I want to be a cattle farmer or a dairy farmer. Or were you already dreaming and thinking and scheming about what you were going to do with your life?
I would lie to you if I told you I ever thought I was going to work in the insurance industry, and part of that is because I didn't know what existed. Mm-hmm. And I would tell you another very formative experience I had. I was young. I was 5 or 6. I got in a farming accident, and I had to get my head stitched closed. And when my parents took me to get medical attention, they took me to the vet. Mm-hmm. And they took me to the vet because I didn't have health insurance, and frankly, the vet was my uncle. Yeah. And I knew that was weird, but I didn't really know how weird that was. Yeah. But it worked, and but that really shaped a lot of my belief, forming on and where I am now around access, around affordability, and how important making sure that people have confidence in that card and what it is. And so when we think about our mission at Blue Cross around providing access, around innovative solutions to improve our members' care and health, that's something that guides me. And so there are a lot of lessons learned from that farm that I've carried through.
Yeah, what a great story about how it does. It connects you through and kind of transitions you through life and what you take in those experiences. So you graduate high school, you find your way to Central Michigan University. That's right, Fire Up Chips.
Yes, we have that in common.
We love that. And, I know you found your way to Lansing after that. You did some public policy work. You did a stint running the House Business Office, did some economic development. And what have those previous positions taught you? I could tell listeners firsthand watching you run the business office, your commitment to excellence, your commitment to budgets, working with people, complex problems, obviously dealing with everything from politicians to staff to vendors. You were able to bring people together. I always found that about you. You're a coalescing personality. But what do those positions teach you and what you utilize today?
Yeah, thank you. I think I spent about 15 years here in Lansing through a number of opportunities, and I would tell you that the theme throughout is that great things happen when self-interest align. Oh. And one of the magic things I think that can happen in Lansing and carrying over to our business and our relationship with hospitals and others is that when you have shared purpose, when you're trying to accomplish something, if you really stop and listen to what the other side is trying to accomplish, in general, there is a way to find a way to do that. And what helps you might be able to help the other side get there as well. And so that great things align and great things happening when self-interest align, I think is really important. And that carried through the business office, that carried through some economic development, that carried through the public policy time. And I think it carries through to Blue Cross now. And, I would just say my undergrad at CMU and my MBA at Michigan State over that time, one of the things that I deeply appreciate about the experience that I had there is, getting back to your earlier question of did you ever think you were going to be doing what you're doing now? I didn't know it existed. And one of the things I'm really thankful for at Central is it prepared me for what I didn't even know existed. And I think if that can be a goal of higher education and that can be a goal of people as they, seek to mature and learn, that's really what it's about, especially in today's world with everything changing around AI, with so many different things happening. People don't know what jobs are going to be out there in the future. And what we have to do is learn how to learn and learn how to expose ourselves so that we have the skills and capabilities to continue lifelong learning.
Yeah, that's what I hear from my members across the state. It really is lifelong learning. It used to be you could go, you find a job, and you stay there for 30 years, retire, get a gold watch, and everybody was happy. Right. And now I think it's down to about every 6.5 years, people not only changing jobs, but changing industries.
Exactly.
And making sure that our educational system can keep up. I find it a little frustrating and concerning because I think a lot of young people now, everything is so goal-oriented, which is good, but it's, I need to learn this to take this test, or I need to learn this to get this certification. And they aren't the same problem solvers. I'm sure on the farm you learned a lot of problem-solving techniques and common sense, and I think that is missing. Is that harming our talent retention and attraction pool?
I have the opportunity to speak to a lot of interns when they come to us and a lot of our younger employees when they come in. And I do really think this goal-oriented thing is a thing. Mm-hmm. And what I mean by that is people need to have goals and that drives people and that's great. At the same point, I have found that so many people are so, I have to be at X level by the time I'm 29. I have to be X level by the time I'm 33. And they're missing so much on the periphery because they're so focused on one thing. And I think being open to different experiences and different learning opportunities is really important.
Yeah, there's always that conversation that the real success is the journey. It's not the final goal.
That's
and I think, and I personally have found myself in that situation before, and I had good family members and people that bring you back and say, no, this is, take a look around, experience this.
That's right.
Because I think it is our experiences, people that shape us and probably shape you as a leader and moving forward.
It has. And you base everything on your own personal experience. So I would just tell you, one of the really fortunate things that happened to me when I was in Lansing is I met a person named Dan Lepp. And Dan Lepp, of course, is the now retired president and CEO of Blue Cross. And he invited me to come to Blue Cross. Actually, just coincidentally, today is my 20th anniversary at the company. Thank you.
That's amazing.
And so when I think of the journey, what that has been, but that was really a leap of faith, and that was never in my plan, right? And so I was pretty happy working in Lansing. I had a good job. I was around working with great people. And he said, you should think about coming to Blue Cross. You could help me set up, how I want to run the company. I joined on the day that he took over as CEO. And, that was a leap of faith. That was a leap of faith by him in me. That was a leap of faith in me in going to a different city, a different industry, a different company that I had really no background in. I virtually knew no one in Detroit at the time. And when I think about, what that took, but I knew if it didn't work out, I'd figure something else out. And I was willing to take that risk. And so I think that's another lesson is that, don't be afraid to jump, right? Take the chance. Don't be a blocker either. Sometimes people are a little risk averse. They stay in jobs that they might not love. I think in general, people, when they take some chances, they don't always work, but when it works, I think they're a lot happier.
What were the biggest lessons you took away from Dan? Like you said, he was an iconic leader for years in the legislative side and the public policy side, running Blue Cross Blue Shield. When you look at him, what attracted you to him? He obviously saw all your skill set and said, hey, come join me. Help me build this. What drew you to him?
Our podcast is not long enough for that list, but if I had to talk about a few, I actually think this concept around great things happen when self-interest align. I mean, Dan had a magic power to see ahead several steps and to bring people together to achieve things. I think that was just a superpower that he had. I think he also had a real talent in finding the right people for the right jobs at the right time. And I give him a lot of credit for that. And I think it's part of what led to his success of running the organization for 19 years.
Yeah, how much of a leader's success is exactly what you said? Finding the right people, identifying that team. How do you build cohesion? It's like being a good coach.
One of the things, there's so many things that I'm really proud of in my first year plus at the company. A lot of it is the great work that my board has done, but it's also in how our senior leadership team has come together. And I am one person, and it's all about what we've been able to achieve as a company and all of our employees. But the work and how the leadership team has come together and really believed in what we needed to do as we went through our financial health recovery, and always with a deep concern around our mission to serve our members. Seeing that in action and how that works every day has been really fantastic.
Now, Dan Lepp did a great job running Blue Cross Blue Shield. You come in, as you said, just about a year or so ago. Is it hard to implement change or to get people, because nothing is static.
Right.
You're going to have change things that, he had in place and the marketplace changes. Is it hard to move off of what the direction he had set and get people to buy into what your vision and strategy is?
I think it's the right leader at the right time. And what I would say is, very, very unusually, Blue Cross, I am now the third CEO in 40 years. And so we've had a lot of longevity at the leadership. Dick Whitmer, who recently passed, was the CEO for 18 years and was the right leader at the right time, saved Blue Cross financially. It was, days from bankruptcy when he took over and brought it really to financial stability. Dan was the right leader at the right time in terms of diversification and diversifying the company into a lot of products that we traditionally hadn't had. Up to his leadership, we were largely a commercial organization, and under his leadership, we went into Medicare Advantage, we went into Medicaid, and made sure that we were serving as many members as we could across the state. The market changed dramatically in the last several years. And as Dan and I transitioned, we've been very public about the fact that the right before the transition, we lost $1.7 billion the year before I took over as CEO. And so you use the data and you use the situation, and our financial performance demanded that we made changes. And so, we use the word, the market has changed and so must we. And that's really been driving a lot of what we've had to do over that time. And we've made, we're making progress. We've had to make some really difficult choices in the last year. But it was always under the auspices of how are we best going to serve our members today and into the future.
How do you prepare for that as a leader? As you're saying, you're having to make real dramatic changes. And you have employees that count on you. You have members that count on you and all the lives that you insure.
Right.
How do you steel yourself to make that tough change? What are maybe one or two things during your time in the company before being president and CEO that prepared you for that?
One of the really great things about the almost 20 years, I had 18 plus years that I had before I took over as CEO, is I had a lot of different experiences. I had the great opportunity to lead the project that we called Blue Night, that united our company, that brought everybody together in downtown, that really helped our administrative costs, change our culture. And I had a lot of experience and learnings in terms of what to do, what not to do, in terms of change management and how we can make great business decisions that still had positive impact on people and the community. That's a thing that really keeps me, getting up every morning. That was a great opportunity. Another great opportunity was, unfortunately, in 2019, the company lost its 4-star rating in Medicare Advantage. It's the highest quality rating that we have. I took that over, and we were able in 1 year to bring that back to the highest quality rating that we could have. That was another great experience. So having those types of experiences prepare you for this. And then, leading back to your last question about then what do you do when you have to make the changes, you make sure that it's data driven and you make sure that you are sharing the why in what you have to do. And like I said, losing $1.7 billion is a pretty good burning platform of why the company needed financial stability and why we needed to make the changes we have. And so, some of those big changes that we've made over the last year, as we have gone out and talked about affordability, and I hope we're able to talk about that as we go forward. But part of that is our own commitment inside Blue Cross to make sure we're doing that. We're never going to ask anything of our partners that we're not asking of ourselves. And so we put a stake in the ground and said we're going to take out $600 million in administrative cost over 2 years. I'm really proud that in year one we took out $420 million of that 600. We don't have a full path yet to get to the 600 by the end of this year, but we're going to get there. Yeah. And we had to make really hard decisions. We are 1,300 positions lighter in the company right now than we were at the beginning of 2025. And we were able to do much of that with compassion with the members and make sure we're taking care of the people who brought us here. And I was really pleased in some of the voluntary separation opportunities that people who decided to leave us, and that's not universal, people who decided to leave us really felt like they were part of the solution. And that goes across the board. It's just not on with the employees, but there's changes we've made in a lot of different practices that we had and how we work with vendors and others, and then transforming our business with the idea of how do we make it best work for our customers and our members.
There are so many challenges you have that you've discussed, whether it's employees, whether it's financial considerations, changing marketplace technology. As a leader, how do you prioritize what to focus on, or do you focus on everything and you delegate to other people?
I think you have to bring the situation forward and make sure that there's shared understanding of what the issue actually is, and then work with your team to determine where to go. And frankly, you have to follow a lot where the money is. And so, when we lost the $1.7 billion in 2024, it's really important to know we paid out $1.04 for every dollar we took in premium. And so you have to follow where that money goes. And so we started talking about affordability, what it meant. Well, of that dollar we took in, 9 cents of that in 2024 went to Blue Cross in terms of to pay claims, to answer member calls, to do our advertising, to pay employee salaries. And we knew that we needed to take care of our own house too. And so I'm really proud that the 2025 dollar bill, where we paid out $1.02 for every dollar we took in, was still upside down, but it's improving.
Making progress, though.
It is making progress, and fast, frankly. Of that $1.02, we actually took that 9 cents that was paid to Blue Cross, and we took it down to 8 cents, which we're really proud about. But those other areas are things that we're working up, because what we know is, affordability is a super murky term, and how do you digest it? And so we started talking about the cost equation, understanding that everything that flows through, whether it's hospital prices, pharmacy prices, physician reimbursement, taxes, fees, and what we pay ourselves, all of those things add up to the premium we're charging members. And so, we're committed to do our part, but we're asking our partners to do that part, and that's what we're out talking about.
Yeah, affordability, you bring up that. I know it's a focus of yours. It's such an important word for people across the state. Their kitchen table economics is affordability, whether it's healthcare, whether it's gas, whether it's groceries. I can tell you in healthcare, the business leaders I talk to across the state, many of them feel like we are in a crisis situation.
Right.
They're getting faced with double-digit increases. They're trying their best to provide the best benefits to their employees. From your vantage point, what are the biggest ones that could be maybe in your control? There's so much out of your control, and that's why I'm amazed at the job that you and Blue Cross are doing, because so much of it you can't control. You have to react to somebody else's decision.
Well, first, we had a real internal conversation about a year and a half ago right now about, do you come out and start talking about affordability? And my stance was, how do you not talk about affordability when that is what everyone's talking about?
No credibility if you don't.
Exactly. And we understand what not only employers are trying to decide in covering their employees, but as you said, at the kitchen table, what family budgets are, et cetera. And so we felt like we had to do that. And so when we started talking about it, we looked at that dollar bill, and we said 47 cents. So almost half of what we're paying out right now is going to hospitals. 25 cents is going to a physician, professional providers. 21 cents is going to pharmacy. 9 to us, 2 to taxes and fees. And so how do we work back upstream to start tackling the costs? And, we have a really great and long history of partnering with providers. We have a great program called Value Partnerships. It's been in the market for 20 years. It's credited with saving over $6.3 billion in medical costs in avoidance in that. And we're really proud of that program and how we've partnered. Again, great things happen when self-interest align, and those great things are saving people money and getting better outcomes. But we believe we need to ramp up that program and do that. And so in coming out and starting to talk about what we're paying hospitals, we elevated that conversation, and I'm deeply proud of the fact that last year, there were 8 hospital contracts that were up, including the 2 largest systems in the state, who, by the way, both own our competitors. So Henry Ford owns HAP, Corewell owns Priority. And if there was any organization that we probably shouldn't have come to agreement with on a hospital contract, it was those 2, because they own competitors. But because we're also committed to getting to the right outcome, to taking care of our members, we were able to strike really good agreements that changed the game in hospital partnerships. And we're paying now for value. We're paying for outcomes versus just paying for fee for service, and the more that's charged, the more we pay, and it's on a per cost basis. And that's the game that we're trying to change, so that employers can understand that what they are paying for is the best outcome for their members. And so those are the types of things that we're doing when we're out talking with people, because it is so important, because, again, that's almost half the dollar.
How big of a switch is that to try to change to pay for outcomes and pay for value? For the listener, what would be a traditional model, and how is this different?
Well, take knee surgeries, for instance. That's a huge cost that's paid, and you can think about the individual components of going through a knee surgery like that. We prefer to pay for bundles, where you can bundle that together, and we partner with the physicians or the hospitals to make sure that we pay in that manner. And then, and therefore, the physician and the hospital are incented to do it in the way that the member most needs it, and avoid some unnecessary processes or procedures on that way.
You made a point to talk about payer-provider partnerships, and you're in tough negotiations right now with Michigan Medicine.
We are.
I don't know if you saw, I recently penned an op-ed on that as well, because that's so important to the business community.
It is so important.
We are trying to support both sides. You're an iconic brand, an iconic business in Michigan. Michigan Medicine's a great provider. And everyone needs you to be able to figure this out. What do successful negotiations look like? Because I think you have shared, I would assume you have shared goals. It's about providing the best care, and how do we do it affordably? How in negotiations do you get people to align, as you talked earlier about, that shared vision of what success looks like?
Let me start by saying that we're really proud of our long-term partnership we have with Michigan Medicine. We have been good partners, and it's my hope that we're going to continue to be good partners as we go forward. But we are in a disagreement right now fundamentally about what nonprofit healthcare means, about what value-based care and paying for outcomes means to that. And as evidenced by the 8 for 8 hospital contracts that we had last year with other folks with whom we signed agreements, we deeply want our hospitals to be successful in the state, and we deeply want access for our members to be able to access them. And, the hospitals who have signed agreements with us in that new model have been very successful in the financials that they've already released from having been in those arrangements. And so I hope that people understand that. In our specific arrangement with Michigan Medicine, we have offered them significant increases year over year for the life of the new contract that we have. And we're committed to work to do that. We were deeply disappointed that they decided to lock our members out effective July 1. We think that puts patients in the middle. We were able to not do that with prior contracts, and so their decision to do that was deeply regrettable. And frankly, we understand it's causing concern for people who utilize that institution as well. And so we're committed to making sure that as we prepare for if they truly fully decide to leave our network July 1, that we're making sure that we can transition members. We understand that it's upsetting, but there are a lot of great providers around the state who are eager to help them and help our members in whatever situations they're facing.
Yeah, it seems to be when you go to those negotiations, it really is what you spoke about earlier. It's a shared purpose of self-interest, and everybody's trying. I could tell you from people who utilize the service, both yours and Michigan Medicine, people are hoping it comes together. So we appreciate the effort you're putting into that.
So are we.
And trying to get it focused on the patient. So thank you for doing that. Are we at a period of incremental change or transformational change, do you believe, in healthcare, whether it's how you provide service or how you interact with providers and how the customer interacts in this process?
I hope it's transformational because it needs to be. As I said, when we decided to talk about affordability, it's because we believe that the industry is in crisis and we're at a tipping point on that. And, it's really my hope that as we are able to change the game to pay for value and pay for outcomes, that those are things that are really going to affect affordability. When we think about all that's happening in AI and coming forward, as we think about the transition that we have to more personalized medicine and solutions that are coming forward, as we think about some of the changes that we see coming in prescription drugs and others, all of these things have to happen. It is, when you think about it, if you don't have your health, you don't have anything. Yep. And it's also my hope that we can change a little bit of the conversation to as much, helping people stay equipped to stay well, as opposed to having a sick care system. And so really a healthcare system. Those are all the things that I hope that we are going to be able to transform to.
How much of that for someone like me, for a patient, I focus more on staying well now.
Right.
Before, when I was younger, it's like, if I got sick, I went to the doctor for a broken bone. Right. And I am more focused on being well. How much of that is a shift among patients, and are we making progress where more people think of it that way? Because it seems like we can do our part as patients by making the system better, by making ourselves more well.
I'm personally really excited about personal accountability and health and wellness. I'm one of the good things that happen out of the Affordable Care Act and the changes that happen there is really a shift toward more services that were available and included in preventative care. We need to continue to have more people take advantage of that. But frankly, we need to make sure people are making really good choices to do that as they live their daily life, and not hope just for one kind of magic pill to have that all happen as well.
As you mentioned earlier, affordability is just the key word right now. It's the buzzword on everything. If there's one thing that our listeners take away from today that they may not understand about the insurance industry, what do you want them to understand about what you and your colleagues are doing?
I want them to understand that we're purposely having the courageous conversations to try to transform healthcare, to try to make it best work for people. And at Blue Cross Blue Shield of Michigan, our mission is to serve our members, to improve their care and health. And so whether it's talking about affordability, whether it's working back up the value chain in healthcare to try to create better outcomes, whether it is doing things on the front end to try to keep them healthy and empower them to do that, and then staying abreast of so many things that are happening in the atmosphere, whether it's AI or others, and bringing those solutions forward. And then, looking internal to our own house too, and making the hard decisions that we've had to make inside. We are committed to all of those things to try to transform healthcare because, one of the things that I deeply respect about the role that the Michigan Chamber has done is the role that you play in public policy and how important it is in Michigan. And, as Michigan's leading healthcare provider, as Michigan's economy goes, so go we. And when we see the things that are happening around population growth or not, when we see some of the things around public policy, we need to be an active partner in that. We are committed to trying to move the state forward and doing the right thing. And whether that is in healthcare or whether that is in kind of general economic climate.
Yeah, no, we appreciate that. You and your team are always very good at leaning in on policy conversations, and I think it is the shared purpose of the state. We're so divisive now. Politics is so dysfunctional. Everybody has a natural reaction to pull back, and this one we need to lean in.
We do.
And when we lean in, we need to bring people with us because we're going to change it by working collaboratively and together. We don't have to agree with everybody, but we have to get back to having courageous conversations, as you've mentioned, and just common sense policy discussions.
With facts.
Yes, facts, data, science. Yeah. Let's deal with that. You have so much on your plate. You're leading so many people. Your decisions impact so many people across the state. Is it ever kind of lonely sitting in your office? Who do you talk to run things by? Or if you just want to vent and just blow off steam, how do you find that person to go to that you can have that conversation with so you don't explode?
Well, I might call you later.
Yeah.
I would tell you that one of the great things about starting in Lansing 35 years ago is that, over time, just like you ascended at the Michigan Chamber, the networks that are out there are just amazing. Yeah. And, whether it's another Blues colleague in another state that might understand the issue that we're going through, or whether it's, someone inside, or whether it's our cherished board members. I mean, one of the great things about Blue Cross is our board and the diverse perspectives that they bring. And I've learned a ton listening to that. And so I think it's the right person for the right time in that. And then sometimes you just got to, power through and go sweat it out too.
And I compliment you and the Blues on having a diverse board and being willing to have people with dissenting opinions and come together, because I think that's how we get the best decision. If we just have people around us who agree with us, we're in a vacuum. There's nothing positive coming out of that.
It's part of the secret sauce of the Blues is that board.
That's great. Fast forward 5 years, what do you want customers and people in Michigan to say is their vision or their viewpoint of Blue Cross?
Blue Cross bent the trend.
Oh, that's
what we want. We want to be recognized for the critical role that we're having in keeping people healthy and making sure that 5 years from now they can afford what they need to keep them healthy.
We've talked a lot about issues. We've talked a lot about leadership. What's the best leadership lesson you've learned from someone else?
I would go back to what I mentioned about Dan is finding the right people for the right time, because nobody can do it alone. And not only that with our senior leadership team at Blue Cross, but I would tell you all the employees at Blue Cross, when they and we have the data to back this up, when they come to work every day, they're there to support the mission. They believe in what we do. They want to provide coverage for people. And so, having those right people aligned around the mission, that's what it's all about.
Yeah, I think any great organization it's alignment and working up.
For sure.
A couple lightning round questions for you. If you weren't doing your day job now, what would you be doing? What is the one passion you would have followed? What's the one thing out of the norm that this was what you would be doing for a living? This is such a crazy thing, but I always wanted to run a restaurant. I always wanted to run a restaurant. I wanted to cater. I wanted to do some things, and I love to just hug people with food and entertainment and create that great environment. So it's Well, I think it's probably what makes you a great leader, because you're trying to motivate other people, whether you're doing it with food, whether you're doing vision and strategy and leadership. As I said before, you have a very coalescing personality of bringing people together. Now, the most important question for all of our listeners, and I know you're a big Detroit Lions fan. Seemed like we had a successful draft. Yeah. What's the outlook for the season?
Well, I had the opportunity to listen to Dan Campbell at an event a couple of weeks ago, and I just love how he pushes forward. Yeah. I just love how he believes, and he's just going to grind it forward with the grit. And so I think there's a lot to learn about having that grit and just moving it forward. Yeah. So,
parting thoughts, your last thoughts as we close up?
I would probably go back to where we started. I think great things happen when self-interest align. I think our organizations have a history of that. I think we have that history with our providers in the state. We look to build on that. We've got a little hiccup going on right now with Michigan Medicine, but I'm deeply appreciative for the long-term partnership we've had with them and the partnership that we have with so many others. And so whatever we do, we're going to be guided by our mission, and we're going to take care of our members.
Well said. That was Tricia Keith. She's the president and CEO of Blue Cross Blue Shield of Michigan. And so much there in this conversation, not just on healthcare, but how she leads, how she works through big, complex challenges, and when there aren't really easy answers. As always, thanks to all of you for listening to My Business Matters, where we bring you the conversations shaping our state's future.